I'm very excited to be here. Of course, I'm Lorraine Cochran-Johnson. I serve as the Super District 7 Commissioner here in DeKalb County, where I represent everything from a small southern tip of Dunwoody South down through River Road in Ellenwood. So I proudly represent constituents in multiple municipalities, and I consider myself a commissioner to all. Thank you all for joining us this evening for our COVID-19 vaccination town hall. I feel that this is a very important topic. I am spurred by the needs of the people. We have received several emails to our office as well as calls from individuals who want to fully understand the COVID vaccine, how to obtain them, what are the health risks, what is true, what is myth, and what is unknown. So tonight, I am very proud to be joined by an extremely distinguished panel of medical professionals who will answer those questions. Before we begin the discussion and have self-introductions, there is a video that I would like to play that will serve as a preamble to the conversation that we'll have tonight. It's no more than about a minute or so, but I do warn you, there may be a commercial prior to the actual video. So if that is the case, do bear with us. And at this time, Allison, if we can go ahead and begin with the video that I believe will put into
sheds light on just how bad the COVID-19 situation is here in Georgia. The report, which takes a look at the most recent 7-day period, shows the state is in the red for all three categories: cases, positivity rate, and hospitalizations. Good day's Mark Teichner breaks it all down live from CDC headquarters. Mark, good morning.
Well, good morning, Ron. It's called the Community Profile Report, and it's based on data submitted to the CDC from January 5th through the 11th for the cases and January 3rd through the 9th for the positivity rates. It's called the Community Profile Report, and it takes a look at how the country, states, and some hard-hit communities are being impacted by COVID-19. And the news for Georgia isn't good. The state falls in the red across the board, 5th in total cases, 8th in cases per 100,000 people, tied for 5th in positivity rate, 5th in COVID hospitalizations, and number 1 in hospitalizations per 100 beds. Locally, the report points out Atlanta as the only major metro area in 4 different categories: high COVID burden, increasing COVID burden, high COVID hospitalizations, and high COVID ICU bed use. Over a 7-day period, the Atlanta area had more than 37,000 new cases. That's up 19% from the week before, and a positivity rate of 18.4%. Health experts want to see that number below 5%. The area has almost 2,600 people hospitalized from COVID, 625 of them in the ICU. Other Georgia communities highlighted in the report as struggling with COVID: Augusta, Columbus, Gainesville, Rome, Dalton, Athens, LaGrange, and Warner Robins.
Even as more and more people have access to the vaccine, it's very important to continue to wear a mask, social distance, follow the public health guidelines, wash your hands. These are the tools we have to prevent the spread.
If there's any silver lining in all of this, no Georgia cities were listed amongst those struggling significantly with mortalities and deaths. But you have to remember that the data that was used in this was all before we had this recent spike that has seen 280 people die from COVID-19 reported in the last 2 days. Reporting live from CDC headquarters, I'm Mark Teichner for Good Day Atlanta.
Thank you, Allison. I appreciate you sharing the video. I think that puts into context why it is so urgent and necessary tonight that we have this very candid conversation. As the numbers of known COVID cases rise across DeKalb and across Georgia, it's really important that we understand the vaccine, the importance of the vaccine, what groups are more at risk, how to go about receiving the vaccine, and what we can do to ensure that we come out of this pandemic successfully. This evening I have joining us, and I will start with Dr. Carlos Del Rio. Dr. Del Rio is from the Emory School of Medicine and Grady Health System, and he is fresh from CNN last evening, a very distinguished leader in his field. And I will allow you, Dr. Del Rio, to please introduce yourself and share what you would find pertinent with those who are a part of this conversation this evening. And I do need you to come off mute. And for all panel participants, please feel free to unmute, because this will be an interactive conversation amongst us at several times.
So it's no wonder that "you're on mute" is the phrase of the year of 2020, right? Commissioner, thank you very much for the invitation. It's an honor to be here. I think all of us in the medical profession have just been just baffled by this pandemic. It is like anything we've never seen before. This year has been a horrible year, and this new year looks to be just about the same or even worse. We have better tools. We have better knowledge. Our hospitals are more prepared. But I can tell you our hospitals are also overwhelmed. People are tired. So what I would hope is that people realize that while we're in a very difficult situation, hope is ahead. And I see vaccines, and research and science has brought us vaccines. And I have the privilege of already have been vaccinated. And I would tell you it's a sense of the biggest side effect of vaccine is an enormous feeling of relief and of gratitude about being vaccinated. And I would tell people, when your turn comes up, get your vaccine, but continue wearing your mask, continue socially distance. We can all do something to stop the spread of this virus today.
Thank you. Thank you for sharing that. And you've answered one of the questions out of the over 70 that we received. After I've had my vaccine, do I continue to socially distance as well as wear my mask? And yes, absolutely. The next distinguished panel member that I would like to introduce at this time is Dr. Christa-Marie Singleton. Dr. Singleton is from the Centers for Disease Control and Prevention. And thank you so much again. I know that you have a great deal of knowledge as it relates to COVID-19 and the coronavirus. So at this time, I would ask Dr. Singleton for you to provide a self-introduction.
Good afternoon, and actually good evening, everyone. It is a pleasure to be here in my almost native Atlanta and to be part of this community discussion. I am representing the Centers for Disease Control and Prevention, particularly tonight representing our Chief Health Equity Officer unit as part of the COVID-19 response. One of the things that this pandemic has kind of put a spotlight on is the racial and ethnic disparities that occur in our country. And CDC has decided that really we need to put our full efforts behind this. And so I'm very proud to be part of a unit that is looking at how we can better mitigate, and which basically means improve how this pandemic is affecting our communities. And we're here to listen as well as provide information. So thank you for the opportunity.
No, thank you. And of course, next we have our own, DeKalb's own, Dr. Sandra Elizabeth Ford. Dr. Ford, of course, is the director of the DeKalb County Board of Health. She has been on the front line since we encountered this pandemic. I would like to say to you, I know that your job has not been easy. And I know right now with the rollout of the vaccine from the federal level, that once again, you find yourself in the middle of a very hectic time. So thank you for exhibiting extreme grace under extremely difficult circumstances. And at this time, I will move for you to make your own self-introduction.
Sure. Thank you, Commissioner. Good evening, everyone. It's Dr. Ford. I am coming to you from my office because I am still here at work. I've been the district health director since February of 2005, and so we're walking into year 16 this year. I am really looking forward tonight to sharing information about some of the concerns I've heard about the ability to acquire vaccine in the county, what some of the glitches are, why they're taking place, what we're trying to do to address them, and what you as a community can do to help us get as many people vaccinated as possible. So I'm very excited to be here, and thank you for an opportunity to share.
Thank you. And last but not least, we have Dr. Marcus C Griffith. Dr. Griffith is a part of the Kaiser community, Kaiser Permanente community. And as a physician, I felt that it was important to have an individual who could speak from the physician perspective. So at this time, Dr. Griffith, I will allow you to engage as well in a self-introduction. And of course, let's come off of mute and feel free to stay off because this is going to be quite interactive this evening.
Well, I've got to take Dr. Del Rio's lead on this. So would you say, Dr. Del Rio, that, take me off mute? But thank you, Commissioner. A truly sincere thanks for you taking this lead on this. And thanks to everyone here in this committee. This is a very challenging time, as we all know. We all went to medical school years ago, and we were never prepared for anything like this. And like Dr. Del Rio, I've also had the vaccine, and there's nothing to fear. Do not fear. The thing that we must fear is the virus and its complications. When we look at COVID-19, it disproportionately impacts communities of color. So this messaging that we have today, it's so important that we are advocates for science and facts and speak out against misinformation and disinformation. That we need to educate ourselves, our family, our friends, our community, our co-workers, and acknowledge what we know and don't know. Every citizen of the world needs to take this vaccine and do this part to bring ourselves back to normal.
And actually, you provide a great segue into the conversation. Allison, one thing that I wanted us to do before we move forward, we've heard the numbers, and I don't want to waste time because there's so much of a conversation to be had. But here in DeKalb County, Georgia, and these numbers were as of Monday. And of course, for anyone who may not be aware, who is a part of this conversation, of course, you can always visit the Department of Public Health. Their website is incredible. It has a great deal of information, and that is where you can register as a DeKalb County resident to receive a vaccine. But myself, understanding and watching this pandemic closely, in District 7, I developed the DeKalbCovidInfo.com website, and we update it multiple times each week with critical information. And if you'll scroll down a bit, Allison, this to the numbers here, this is what I want people to see. Currently here in DeKalb County, we have 39,522 confirmed cases. We have had 506 deaths. Our hospitalizations are at 3,254, and non-hospitalizations, these are individuals who may have self-quarantined, are at 36,258. Now, if you will choose statewide daily, because I think when COVID initially struck, we were all caught off guard. We were all very unnerved. But I created this website because what I found is that over time, I felt that we began to become desensitized as we entered the holiday period, which was a very critical period. So I felt it was necessary to create what I call the Join Me campaign. Join me in social distancing. Join me in wearing a mask. Statewide, you'll see that we have 636,373 confirmed cases, and this was as of Monday. Statewide, over 10,000 deaths and 44,000 hospitalizations. I will now ask Allison that you choose the global daily numbers. 90 million total cases globally, almost 91. Recovered cases, over 50 million. And deaths on a global basis, we have lost over 19 million people to this pandemic. So the development of a vaccine and a way to combat what we are dealing with is absolutely imperative. So now that we are in the process of rolling out the vaccine, Dr. Griffith, again, you did a great segue into leading us, and thank you, Allison, for pulling that up, into a formal discussion. We already understand that COVID has a disproportionate effect on certain communities, African Americans in particular, and there are a variety of underlying causes that often cause that effect within our community. And there is a great deal of distrust in vaccines. I think there was a race to create a vaccine, and rightfully so when you're in the middle of a global pandemic. But I believe that that race initially caused many to be hesitant to say that it's important that we have something. Is this the best thing for us? So is this a vaccine that we should take? So I know that there's been some discussion there, and Dr. Del Rio as well as Dr. Griffith has indicated why they feel that it is important. But I'd like to go into a little bit greater discussion there, beyond the fact that, you know, in order to curtail a pandemic, we have to reach a massive amount of people. And at this point, we're in the rollout stage of the vaccine itself. So I'd like us to engage in discussion on how, through vaccinations, or the Moderna as well as the Pfizer vaccine, we can eliminate the spread of COVID. And I will open the floor at this time for all to comment very freely on why it's important and what will be the end cause. Because I think we have to reach a certain level here, honestly, for even the vaccine to be effective. And we're not there.
I'd like to start with just a very simple comment and observation, is that, you know, when we look at the life expectancy in the United States, in 1900, the life expectancy was 40 years old. The life expectancy today, you know, 100 years later, is 80. The difference is vaccinations. Back in 1900, people were dying from influenza, you know, tuberculosis, polio, infectious diseases. Today, because of vaccines, we have an extended life. And so all of us, every single one of us here has been vaccinated. We've had more shots than we can count. You remember as kids, we had that MMR, the measles, mumps, rubella. We took it blindly. We didn't know what was in it, but we took it. This vaccine has been studied extensively by the world, okay? And think about this, MMR, measles, mumps, rubella. At what point in the United States before did you have 4,000 people a day dying from the measles? We got 4,000 people a day dying from COVID. Get the shot, please.
Dr. Griffith, I'd like to throw in and add to this. Even though this particular virus is new, but coronaviruses, which this is a member of the family, have been around for quite a while. And part of, I think, some of the public's hesitation might be because of the name Operation Warp Speed. And so those people that are Star Trek fans or, you know, space people, they think, oh, it's super fast. And one of the things that we've learned is that this technology has been around for quite a while, being used in other spaces. And when our scientists learned about it, they were able to study it, and we're still studying it. And this concept of what they call herd immunity, we're still studying that, but we need more people to get vaccinated. And the best way to learn if it's best for you is to, of course, talk with your healthcare practitioner to get information for specific for you. But as Dr. Griffith and you and Dr. Del Rio have said, it's important that people ask the questions to make it fit for them so that we can get vaccinated and help in the pandemic.
So let me just say that I totally agree. We have been studying coronaviruses for a long time. After the SARS coronavirus, we started developing vaccines for coronavirus, for the SARS coronavirus. When this virus was identified, and we realized that the spike protein it's a very close cousin to the SARS coronavirus, and the spike protein is very similar, and that was where the vaccine needed to be directed. We could build upon that work that had been done with coronavirus. But I want to give people a little piece of information that they may not know. The lead on a lot of the research around the coronavirus vaccines is actually an African-American woman immunologist at the NIH. Her name is Kissy Corbett. And Kissy is somebody who's been working for years in coronavirus and in mRNA vaccines. So this is something that I always tell my patients at Grady, my African-American patients, when as an investigator in the Moderna vaccine study done at Grady, we enrolled 42% of our participants were African-American. We're very proud of that. And I always told them this vaccine was developed by an African-American investigator. And you need to realize that, it's something that the world came together to develop. And that as an investigator, I can tell you, I have never seen such a collaboration between government, industry, scientists, and the community. I've never seen a study that was able to enroll so many people so quickly. And the reason we did it is because the community partnered with us and we rapidly enrolled the people. Now the vaccine, and I want to make this very clear, the studies have shown that the vaccine is incredibly effective. We had asked the FDA to give approval of a vaccine that had 60% efficacy. These vaccines were like a home run. They have a 95% efficacy. But the efficacy is to prevent disease, and primarily severe disease. We do not know yet if the vaccine prevents infection. We may know it later, but that's another reason why after vaccination, you have to wear a mask, because I'm immunized, but that prevents me from getting sick, but I don't know if it prevents me from getting infection. So we need to be very clear on all these concepts because it's complicated. And I think we need to repeat them over and over. And again, I hear many people say there's vaccine hesitancy. I think people just want to talk about it. They want information, and we need to be there to answer questions.
Very great point that you raised, and that, of course, answers one of the many questions we've received in terms of the efficacy rate and how effective is the vaccine. Also, one of the major questions we've had is what is the difference between the Moderna and the Kaiser vaccine, and is one better than the other?
So is the difference between Coca-Cola and Pepsi? That's what I tell people. They're both soft drinks. One is Coca-Cola, one is Pepsi. They're almost identical. And I can tell you that I'm a Moderna investigator. I got the Pfizer vaccine. So I tell people that although I work with Coke, I got Pepsi.
Well, there's quite a few responses there in the chat as to Coke and Pepsi. But the key is that both of these are and have demonstrated in clinical testing to both have almost mirror effects in terms of the efficacy rate. So I do not believe that whether you choose Coke or Pepsi, or in this instance, the Moderna or Pfizer, that there is a diminished response, or that you are not, shall I say, protected. Another question that I would ask, what side effects can individuals expect to experience after receiving COVID-19? And are these side effects severe? I remember when the vaccine first began to roll out, and this I would love you to answer, because as I said, this is trying to uncode the truth, the knowns, the unknowns, as well as the myths, is that individuals have been known to have Bell's palsy, has been one of the outcomes. But I also did some reading, and I found that there was not a great enough occurrence to indicate that it was a direct result of the vaccine. So let's talk about the known side effects, if any, because I do believe also that after a person is vaccinated, there is about a 15-minute wait period that is requested. So if you would answer whether or not that is true, that would be wonderful.
Well, if you want me to start getting into vaccine logistics, that's going to be a lengthy discussion. So are we ready for that piece yet? Because I see the question.
Absolutely.
Okay.
Absolutely.
So let's talk about this process. First of all, let me just say that DeKalb County Board of Health received its first doses of vaccine on December 31st. Today is January 14th. We started our rollout of seniors on Monday. 65 and older, their caretakers and first responders started on Monday. Today is Thursday. It is unreasonable to expect that the entire county was going to be immunized solely by the Board of Health in 72 hours. Let me explain the process by which someone is acquiring immunizations. First of all, there was a website set up by the Board of Health to take first a registration. Once you register, you were to receive a link that would allow you to make an appointment. Our first supplies of vaccine in the county were limited. Our first dose that we received from the state was 2,500 doses. So obviously that wasn't going to go very far. And we have to schedule appointments based on vaccine availability. It makes no sense for us to schedule appointments into March with 2,500 doses. So we scheduled those first batch of doses. We have since received additional dosing, but again, we have to be mindful of quantity. When we were intending to open up the site on Monday to expand it to include our senior population, at noon on Friday, the 8th, we opened up the registration site for seniors and first responders and seniors caretakers. By 2 hours later, we had close to 7,000 registrations. By the end of the weekend, we had 20,000. Our staff can do about 1,000 immunizations a day. So it made no sense to continue to keep the site open because you would be putting in appointments through March, April, May at that point, at the rate that we were going. And so the site has been shut down in order for us to address those 20,000 people that are waiting for appointments. Obviously, the list has decreased. We're doing about 5,000 immunizations a week. And so now we have about 15,000 people that still need to be scheduled. The intent when the COVID vaccine was first distributed from the state level was that we would have the support of other providers. The DeKalb County Board of Health, just like every other public health district in the state, has been shorthanded since COVID began because our staff are the same staff that have the issues related to schools being closed and people having to be home with their children that are medically fragile and can't come to work. And so since March, Board of Health has essentially been working with a third of regular staff, but 3 times the responsibility. And so we have been trying to manage this process, but the expectation when this vaccine became available was that this was going to be a community-wide effort. When the list was provided for entities to sign up to be either private providers or public providers, that was a shock to me. Private providers are those people who signed up, entities who signed up, doctors' offices, signed up to receive vaccine. They only vaccinate their staff and their patients. Even given that, we only had about 77 physicians' practices throughout the county that agreed to be even private providers. When it came to public providers, which is the real game changer for us, because that means they're immunizing the community, we have 2 so far. One is an entity that can literally do 20 vaccines a day. The other is a pediatric practice, and as you know, we're not even immunizing children yet. So this is what we're dealing with. So the expectation is that my crew of however many doctors and nurses that we have are then tasked with trying to immunize the entire county. That was never the intent when it came to vaccine distribution. We are continuing to work on that list. People keep saying, well, why don't you just hire more people? There aren't more people. The demand for nurses nationwide is overwhelming. I saw an ad for California nurses offering them $130 an hour. We can't compete with that. Even when the state was assisting us in providing contract staff to work with us, the contract staff were making so much more than Board of Health staff that my staff were quitting and then working for the contract, which serves no one. So we are doing the very best that we can do, so much so that I have literally encouraged volunteers to assist us with this effort. We had an event yesterday that was strictly volunteer, because I can't pull staff away from their daily responsibilities at these large sites to work on small projects. But what we can do is ask community physicians to assist us, and that's what we've been doing. But that's a stopgap measure, because it still requires a lot of machinations even to make that happen. And so, you know, part of the issue is that the challenge with getting appointments is also that people are not adhering to the rules of getting an appointment. The appointments, when you register for your vaccine, you will receive a link. That link allows you to then schedule your appointment. If you share that link with other people, then they make appointments that we don't have a registration for. And so when they show up at the site, they show this, you know, and I've seen it on Facebook being circulated. Oh, here's how you do it. You just click on the link. Well, that completely bypasses the registration system. So when that person shows up, they have to be registered now, which takes time. Now, if we turn you away and say you don't have an appointment because you didn't register the right way, then that's a call to a commissioner or a call to the state, when in fact you really try to circumvent the system. That's problem one. Problem two is if your appointment is at noon, don't show up at 9 o'clock. Perhaps you think you're being helpful, but all that does is back the system up, because then if I see you at 9, you've thrown off the appointments for the rest of the day, because there are multiple clinicians. And so there are multiple 9 o'clock appointments. So if we pull up to set up at 9 o'clock and there are already 50 cars lined up, we already know we're going to be behind. And it just throws us off also for our counts, because I have heard questions about a wait list. Can there be a wait list at the end of the day? I can't do that because I can't predict who's showing up and who's not. The first few days we had a challenge with no-shows, but that has not been the issue moving forward. In fact, we have more people showing up than we have appointments for. People showing up saying, oh, I thought I had an appointment. Oh, I'm confused. Can you just see me? It's not fair. It's not fair to people who were patient enough to sit through that time-consuming process to sign up, and then you just want to jump the line. I am concerned for my staff. I have been appalled at the way they have been treated by folks in these drive-through lines. I will remind you that at the crack of dawn, when we start to set up, it's 30 degrees outside. And so what I will not have is citizens sitting in their warm, heated cars, cussing out my staff who are standing out there in the cold. We are all trying to do our best. And this process was not expected to be a singular process. It was expected to be more community-wide. And I'm looking at even some of your current QA explaining how other entities have been turning away their own patients and directing them to us. And so we're asking for community-wide support, because this is a community-wide issue. And if you want to see fewer hospitalizations, then we need to see more people out here assisting with passing the vaccine out. I am also looking to identify closed-in space for my staff so that they don't have to be outside in the elements anymore. But that's a challenge, you know, with a drive-through process. You know, getting an area large enough, and even in a walkthrough process, getting an area large enough to allow for social distancing and safety and all those types of things. But, you know, I'm very mindful of their safety as well. And so I continue, as I have been, to ask the community for their patience. Please stop sending me nasty emails. We are doing our best. And I don't have a solution. There is a statewide scheduling platform that has been proposed. It will not be available until mid-February. And so until then, we will be fighting to try to manage with the current system that we have in place. Even the statewide system, as with any new system, I would imagine that there'll be some glitches attached to that as well. DeKalb is a very unique community in that we have a huge language issue here. And so at some point, we're still going to have to manually take a lot of phone calls and register people. And this is where we are right now. I hope that kind of clears up some of the issues because, you know, the staff are really overwhelmed and everybody is doing their very, very best.
Maybe this is a good segue where I can add something on behalf of the community in Kaiser Permanente. And so, you know, I'm a resident of Super District 7 and a resident of DeKalb County, and we are very thankful for what DeKalb County and you, Dr. Ford, are doing the yeoman's work. And as Dr. Del Rio referenced that this is a combination effort and of private, public, and industry partnerships. Kaiser Permanente is very fortunate to be a steward of the vaccine. Kaiser will offer the vaccine to anyone, And so let me explain how the process works. Even if you are not a Kaiser Permanente member, you can call our call center at 404-365-0966 to schedule your vaccine, as long as you are within the categories as identified by the Department of Health in the state of Georgia. One, if you are a healthcare worker in a clinical setting, includes nurses, doctors, EMS, laboratory technicians, or if you are a resident of a long-term care facility. It's expanded now to all law enforcement, fire personnel, including volunteer departments, and then all persons aged 65 and older and their caregivers as applicable. So we have the Pfizer vaccine at our Southwood location, at our Gwinnett location, the Moderna at our Town Park facility, and within the month, we will have a tent set up at the Panola location. So what you'll do is you call our number, 404-365-0966, inform them that you're in one of those categories and would like to receive the vaccine. Then someone will call you back within 3 to 4 days to get you scheduled.
We'll be posting that number as well.
Yes, please do.
The number has been posted to the chat.
Please do.
And of course, yes, for those
we recognize it is all hands on deck. And we're thankful with Kaiser Permanente to be a part of this community and help to mitigate and cure this disease.
Thank you.
And thank you, Dr. Griffith, for what you just shared. Because again, what we're seeing here is hysteria, because there's many individuals who desire to be vaccinated, and dealing with limited quantity. As I'm watching the chat, I noticed an individual who said, when will or can we expect that the registration lines will be open? At this point, I would be forward, you cannot say, because the request has been so much greater than the ability to respond and to provide the vaccine, because we do not honestly in the Department of Public Health have the staff to do so. And at this point, there are not enough secondary providers who have signed on to mitigate the heavy burden. These are things that I had to understand, because as a commissioner, when I received the call, my first responsibility is to understand what is happening. But I would also like to say to Ms. Melissa Nelson, as well as Ms. Skelly, who is on the call, they both wanted to say, Dr. Ford, thank you. They both had very pleasant experiences, and it was very well organized at Stonecrest. So the questions remain as to side effects. I've seen several questions pop in concerning Bell's palsy. And again, based upon my research, and I'm not the medical professional, there was not a great enough correlation between the vaccine and Bell's palsy to say that what was experienced was a direct result. If I'm wrong, please correct me in making that statement to any of the professionals.
So let me just first start. I'll address that, but let me just start by saying, first of all, I want to echo Dr. Griffin's comments and thank Dr. Ford. I mean, the county is, first of all, let us just say that for years, public health has been underfunded. And it's really hard to get this done without funding. And right now, I'm hopeful that the new administration will provide funding. President-elect Biden is having a press conference tonight, which is announcing his plan. I think when funding going to the states, I mean, I tell people this is almost like the federal government sent bullets to the states to fight a war, but said, okay, it's up to you to recruit the soldiers, buy the rifles, train the troops. You can't fight a war like that. So I think we need funding, but also a lot of people haven't, volunteered, as Dr. Ford said, because everybody's busy seeing patients in the hospitals. We're all overwhelmed. I mean, we're having trouble keeping nurses in the hospitals because they're absolutely right. They're getting paid more if they go to California, or they're getting paid more if they're a contractor. So we're going to have to think outside the box. We're going to have to do something. This is the biggest ever immunization campaign this country has ever done. We don't have in our country a good way to immunize adults. We have good ways to immunize children, but not adults. So this is totally uncharted territory. And yes, absolutely, we all need, it's an all hands on deck. So there are a couple of questions about what Emory's doing. Emory Healthcare has been immunizing over at what used to be the old North Lake Mall in the shopping center there. And they set up an operation that I think it's a very well run operation. Again, mostly run with people that are volunteering. I've been out there immunizing myself. My wife has been out there helping, because even though they have staff, they don't have enough staff. And in fact, a lot of the staff immunizing are staff that also doing the COVID testing. So you either test or you immunize. You can't do both. But anyway, the first weekend we opened, we immunized over 6,000 people in a weekend in this operation. But it requires a lot of space, a lot of coordination, a lot of resources. What Emory's doing now, there's a website you can go to. And if you have been an Emory patient, Emory Healthcare, in any of the Emory Healthcare hospitals with clinics in the past 3 years, if you've been seen once, that's all it's needed. Yeah, that makes you a patient. You can register and you'll get an appointment. Now, again, as Dr. Griffin said, you have to be within the categories that the state has authorized. I cannot go there as a 50-year-old and say, hey, I want to take the vaccine, because you won't get it. But we all trying to work as hard as we can. This is not going to be easy. I think we need people to be patient, but we also need to remind people that we have a way to prevent COVID now, and it's called wear your mask, socially distance, and do all those things. So please continue doing those things and then get your vaccine. As far as side effects, the major side effect of these two vaccines is pain at the site of injection. You may also feel little chills, fever, headache, feel kind of tired, especially people that have had COVID tend to have those more severe symptoms the day after. That's just your immune system waking up. So in other words, if you get a little fever or chills of the vaccine, say, thank you. This vaccine is working on me. My immune system is waking up and making antibodies. There are other side effects that have been reported, one of them being Bell's palsy, but it's really hard to link it to the vaccine because Bell's palsy happens in the community. So for example, if I take the vaccine today and I drive home and I have an accident and so is the accident related to the vaccine? Was that a side effect? Or was it just because I was going to have an accident and the vaccine was there? And that makes it really hard to tease that out. CDC has put together something called V-Safe. That is a way they're trying to monitor side effects from the vaccine. And if you have received the vaccine, I encourage everybody, it's totally voluntary, but I encourage everybody to sign up for V-Safe, because this is how CDC is monitoring these very rare side effects. And maybe Dr. Singleton can talk a little more about that.
Absolutely. So again, people talk about side effects, but I guess as a former practicing pediatrician, I like to say these are the expected effects. So things such as when you get a shot, if someone is sticking a needle in your arm, it's going to hurt, which means your arm's going to hurt. So that's what goes along with it. And yes, several people, about 50% of the people they're tired or they might get a fever. And there were news reports of someone in, I think, the United Kingdom, right, who had what they call an allergic reaction, where because she had had reactions before, but CDC and others have looked into that further, and it turns out that the number of individuals that had a reaction where they might need to have an EpiPen or something like that has been very, very small. And we just published on our website a report on that. So that's less to be thought about. But yes, as Dr. Del Rio is saying, is that CDC has a couple different safety systems in place. The one that is the newest is called vSafe. And so if you have your smartphone, you get the vaccine, then you can register on your phone. And then if something should happen to you or you feel a certain way, then you can let that scan QR code know that you'd like to have someone followed up. We also are using a system called VAERS, and that system has been around for a long time. And that's a system where you, the public, can call in or your doctor can call in, and it collects information so that we, CDC, and other researchers can then look and track this over time. So we have plenty of places to monitor. Right now, we have not seen anything, and we're keeping our eyes on should there be side effects that are going to be harmful. But for right now, we have not seen any significant side effects.
These are all very great points. And I did want to point out, because I'm trying to multitask here, and I'm seeing many people who are interested in volunteering. And Dr. Ford, because I'm so frequently on and off the Department of Public Health website, I did notice that there is an area where you can click and volunteer. If there are individuals out there amongst us, because I know that for an event that was held just yesterday at Lou Walker Senior Center, many members of Delta Sigma Theta sorority and other organizations who chose to volunteer and be taught how to administer the vaccine were on site. So there is an option. Please go to the website, because one thing that I've found through all of this, whether we are talking about food insecurities during this time, because I see it all. I receive requests for everything you can imagine. This is going to take a unified effort amongst community and organizations, as well as local government, for us to combat what we are dealing with. What we are dealing with is bigger than an individual. One of the questions that has come in and that I wanted us to answer here is, as it relates to an individual who is taking the COVID-19 vaccine, does this infect an individual with the actual virus? I know that Dr. Del Rio said that it wakes up the immune system, so to speak, when you receive it. And oftentimes, I know personally that I've heard all my life, if you take the flu vaccine, that you're receiving a strand of the flu. And often you have the sniffles and a runny nose and some of the side effects that you're hearing here. So can we speak as to when an individual is receiving the COVID-19 vaccine, are they being injected with a certain form of or strand of the virus itself?
They're not. And let me tell you, this is really cool technology. And the way I explain it is the following. A friend of mine showed me this, and there's a nice video that I'm going to put there in which he explains this. There's the DNA, and the DNA is our blueprint, our genetic blueprint. That's inside the nucleus of the cell. The DNA prints out RNA, and the RNA moves from the nucleus to the cell cytoplasm. And in the cell cytoplasm, that RNA then directs the cell mechanisms to start producing proteins. And that's how cells produce proteins, like your coagulation factors and your blood clot factors and all those things. Well, here, what we take in the vaccine is they put a little piece of the genetic material of the spike protein, and they made the mRNA for that spike protein. So it's not even the spike protein, it's the mRNA that codes for the spike protein. And when you get injected, that mRNA goes into your muscle cells. It doesn't go into a nucleus, into the cytoplasm of your muscle cells, and then tells your muscle cells, start producing the spike protein, and then uses the cell mechanisms to produce the spike protein that then is produced, goes to the surface of the cell, and the immune system sees it, and then the immune system starts producing antibodies against that spike protein. So you're getting, it's almost like this friend explains it as the DNA is the blueprint of your house, the RNA is a contractor. This is like getting a contractor going to your house to build something. And then the contractor, once it's done, what happens to the contractor? They leave your house. They've done the work. So this mRNA that you get in there disappears from your cells and you won't see it again.
Dr. Del Rio, I think it's important also to remind the audience that this mRNA, this does not interfere or interact with your own cells in any way. It just makes your body just to start jump-starting what it needs to do, but it does not interact or confuse or change your cells. That doesn't happen with this particular vaccine.
Thank you
that was
for
one of
that
the questions
explanation. I think Dr. Del Rio gave the clinical version, but I do believe that everyone fully understood that you are not being injected with any form of the virus. What it does is awaken the system to create antibodies, and this is the elementary version, that will then fight to eliminate the virus within the body. I have a question here concerning individuals who have already taken the first dose, but they are now having trouble, and or I've had one individual who said they were not able to find anyone to administer the second dose. Once you have received the first dose and you were ineffective in receiving the second within the time allotted, I believe, which may be a 4-day period, and I would like for us to speak as to that. Can you please share whether or not it negates the initial vaccine?
Well, I'll talk to the second dosing issue because I know a lot of people received that first dose. Those who received the first dose from the Board of Health, we just got a system in place this week to schedule that second dose. So the folks that got it a little bit earlier, we will be reaching out to you directly to schedule that second dose. The problem, that one of the challenges for us is that a lot of people got their first dose somewhere else in the county or in the state, and now they're coming to DeKalb for the second dose. And that's a little bit more of a challenge because we really didn't consider, from a numbers perspective, if we did 100 vaccines today, we want to have 100 vaccines for dose 2 in 4 weeks. And if people are coming from outside places, it makes it a little more complicated, but we're still trying to work around that. Right now with the site being down, that's a big challenge for us. And so that's why I'm happy to see Kaiser and Emory to some extent trying to join us with this process, because that is the next challenge for us. Probably what we're going to have to do is have one single site that's just dose 2 so that we can have it separate from everybody else. That's probably the way that's going to have to work.
And as I see the questions, because again, this is a novel virus. We've not dealt with this on this magnitude. And as I hear this, I do believe that that is exactly what we're going to need to do as we're moving forward. So we're learning as we go. And I'd like to thank everyone for all the robust conversation here. I have individuals who have questioned whether or not an individual who may be pregnant and or breastfeeding can actually receive a COVID-19 vaccine, and if it poses any risk to fetus and or child. Can anyone speak, and or are you aware of any research in those areas? There's actually several questions as to whether or not it will cause infertility, potential miscarriage, and personally, I have not, as well as fetal issues, I have not seen any indications of those. But again, I defer to the medical professionals. And again, on this conversation, we are not here to manufacture any results or answers. If it is something that is not known, then please feel free to say that, and we will not answer the question. But
well, so the American College of Obstetrics and Gynecology as well as the Society for Maternal Fetal Medicine, has put out guidance, and their guidance recommends that pregnant women and lactating women receive their COVID vaccines. I can tell you that both my daughter and my daughter-in-law recently had babies. They're both lactating, and I have recommended that both of them receive their COVID vaccine. My daughter-in-law is a clinical person, so she already did. My daughter is not, so it's going to be some time before she gets it. But if they were pregnant, I would have also recommended the vaccine, because the complications of COVID during pregnancy are really concerning and something that you don't want.
Yeah, that's what our CDC pages actually do recommend, breastfeeding women as well as pregnant women, because pregnant women have been shown to have worse outcomes from COVID. But what we tell these individuals is that you should check with your healthcare provider first to make sure that everything in your particular situation works out. But yes, pregnant women and lactating women particularly if they are healthcare personnel, should be considered for the vaccine.
I think Dr. Del Rio's explanation of how this mRNA vaccine works is very comforting, because the vaccine does not enter the DNA, and it does not run the risk of making someone infertile. And so that's also, one of the common concerns. I'll get this vaccine, I'm going to be infertile. No, that is not the case.
And I have another interesting question here. Will more people die as a result of a negative side effect of the COVID-19 vaccine than would actually die from the virus? To my knowledge, I am not familiar with a known case of death that was caused by the COVID vaccine. I may be incorrect, but I like most people, as a layperson, I read. I've not found that to be the case. But can anyone speak as to whether or not the COVID-19 vaccine side effects could cause death?
Every day in our country, close to 4,000 people are now dying of COVID. I worry about dying of COVID. I worry about being critically ill and being, left in bad shape as a result of COVID. There's nobody that I'm aware that has died of COVID vaccination. So the vaccination is safe. Again, there have been some side effects, but the side effects, honestly, compared to other vaccines, are minimal. I mean, I really think that this is, because it's a very different technology, this actually may become the technology of many vaccines in the future, because it really changes the paradigm on how we develop vaccines. You're not getting a whole virus, you're not getting an inactivated virus, you're getting really a very molecular, I call it a designer vaccine.
Thank you for sharing that, because again, I'm not familiar with any deaths that have resulted from an individual who has received a vaccine. One of the resounding questions that I've seen here is for people who have already contracted COVID-19. Is it necessary for me to take a vaccination? The second part of that question is for people who may have already contracted COVID. Is there ever the potential that they will have or contract COVID again? Is there any medical research in that area that you're familiar with? Because of course, as it relates to side effects, and we have developed this vaccine at lightning speed. And I do believe that over time, there will be additional bodies of research that develop. But I would like to hear, if you have had COVID, is it even necessary to take the vaccine? And if you have had COVID, whether or not you have the possibility of contracting it again.
Well, I'll start that we have, CDC is studying what we call reinfections. So looking to see if people who, let's say, had COVID, let's say in the early days, March, April, and there have been some people that have contracted it again. And so right now, we recommend that if you've been in that window of 90 days, then you'll probably have some sort of immunity. But what we know is that we don't know how long someone's immunity will last. So right now, individuals who have had COVID, when their turn and the line comes up, they should be in line as well, because we don't know just right now how long that immunity lasts. We know that when you get it, so today, January 14th, at some point I will develop some immunity, but we don't know how long that will last. That is why it's so important to be part of this process so that we could discover that. Because one of the things is that we don't know how, if you get infected with COVID, how long or what type of reaction you will have. So the vaccine, along with wearing your mask, staying 6 feet apart, washing your hands, are all of those steps together is what can help us prevent COVID.
So Dr. Singleton, so, it's not like the chicken pox. So once you got the chicken pox, you'll never get it again. This is nothing like that, right?
You muted.
Dr. Singleton, you went on. Yes,
yeah.
Great.
We're sorry. We right. There have been some cases of reinfections, and so that is why the vaccine is, along with wearing your mask, staying 6 feet apart, washing your hands, all of those mitigation steps. I call it like the four-legged stool. You can't just do one and say, oh, I got my vaccine. I got one, I'm good. You get two, I'm good. You still need to keep doing all of those measures.
Something else that we haven't discussed is that if you have had any other immunization in 2 weeks, you need to have a 2-week period between that immunization and your COVID vaccine. And we don't really talk about that much. So that's including your flu shot. So be sure you space those appropriately, because that's yet another reason for us to tell you to wait. So FYI.
And thanks for sharing that, so that people can be responsible in booking when we are able, or depending upon who you're reaching out to. Another very common question that I've found is if you have allergies. In particular, I've seen people inquire about allergies to eggs or any other form of allergy. Is that cause for alarm? Or are there any known side effects to allergies or individuals that have allergies that are associated with the COVID-19 vaccine? And again, I want all that are a part of this call to understand that this is very much emerging and evolving. We learn more each day. And personally, but again, I do a lot of reading. I have not seen that there has been negative effects for individuals that have allergies. But again, from a medical professional, if anyone is comfortable answering that question, please do so.
There
Again,
is no risk.
No eggs in it, right? They're not. These vaccines do not contain eggs, and they don't contain latex. And I know that's a common allergy. People are allergic to those, and so you should be safe there.
Agree.
Okay. At this time, I am going to.
There's actually a question here. It's a question in the chat about.
Uh-oh.
I'm sorry, Dr. Griffith, were you making a statement?
I had a quick question. That since one thing I love about these programs is, I learn from everybody, from the community, from you, Commissioner, all the docs. So I've been locking it down. I've not been going anywhere. I've been staying home, haven't seen my dad, haven't been on an airplane, haven't been anywhere. So I got my shot now. I got both of them. So the question I want to ask these folks is, in August, will I be able to go see the Falcons at Mercedes-Benz Stadium, given that I've been fully vaccinated? I don't know.
Well, I'm not if there's the Falcons, first of all.
Why? Are you sure you want to go there?
I would love to be able to predict that, but my crystal ball right now is very, very fuzzy. We have heard predictions that if people are, if we can get this vaccine into enough folks, that things may end up getting back to normal. I don't know, August is kind of aggressive, but hopefully like by the fall, I would love to see some semblance of kind of our usual operations. I'll let my...
And I think I think when you say fall, I believe that it will be late in the year before we begin to see the true, yes, the true results of the vaccine.
I tell people to think about Thanksgiving next year. Maybe Thanksgiving next year, we will be back to having a normal Thanksgiving, at least more normal Thanksgiving.
I fully agree. And I also noticed earlier there was a question concerning whether or not it is acceptable to travel during this time. Or if you have had the COVID vaccine, can you travel freely? And I will take executive privilege and say no. I have seen, and I watch the news. I'm a huge avid CNN, NBC, ABC, Fox 5, CBS 46 watcher. And there was a gentleman that many of you may have seen just the other day who each year engages in international travel in December. And he traveled abroad. He, of course, if you go to our DeKalb COVID info website, there is a global map, and you can click there and it will tell you the status and high alert for places all over the globe. And it showed that Georgia was a medium risk. Well, upon arrival, he was told he was high risk and he was sent back. So if you're going to engage in travel, you need to be very conscientious and understand that in many instances, I've known people who missed the vacation because they were immediately placed in quarantine for several days, even though they had tested negative before travel. And by the time they were released, they had 2 days and they came home again to be placed back in quarantine. So I don't know what travel means to you. I know personally, having, an elderly aunt and also dealing with a multitude of folk, that for me, I have learned to embrace Zoom as much as possible for communication outside of anything that is not absolutely necessary. So do know that you may be subject to quarantine if you travel, and that by taking a COVID-19 vaccination alone, that does not mean that you can roam about the world freely. If there is any different assessment, I welcome anyone else to have input there. I am also looking through questions that have come in.
Well, while you look, I mean, the guidance is changing so rapidly that people who are already left the country, now it's a different requirement for them to get back in. So you better be careful if you leave the United States that you could actually come on back. So we're really just, unless you just absolutely have to go, there's really no reason to put yourself at that level of risk.
And I have come to a question here, and I think this is very important because in 2020, we dealt with unprecedented events, both social unrest on a level that we have not seen as a society, as well as a global pandemic. And this question is from Mr. Jose C. And according to the question is, according to the Migration Policy Institute, DeKalb County has an estimated 36,000 unauthorized population or undocumented residents. What is the plan for vaccinating this community? It is imperative that everyone has access to the vaccine. During the registration process to get the vaccine, it asks for a driver's license. Due to Georgia laws, undocumented immigrants do not have access to a Georgia driver's license. Would these individuals be able to prove their identity and age with consular IDs or passports? This is a very important question.
I'm so glad you asked that question, because we had that same question around COVID testing. Disease does not respect
care whether you're documented or undocumented.
Exactly. Disease does not respect birthplace, and so I have no concern as to where you were born. And the driver's license is merely a way for us to have some sort of verification. And so we're asking for whatever you have. Essentially, all we need to do is have a record for you and a way to contact you in order to schedule you for your second immunization. That's about it. And so, yeah, absolutely. We are open to whomever comes and has some form of identification. It does not have to be a driver's license.
Great. Now, this is a very valid question. How can someone receive notification when new vaccines are available and where they are allocated in DeKalb County? I know that this week earlier, we had discussion from individuals who said, well, it's not available. And how will I know? And thus far, in all honesty, because I'm not here to manufacture results and answers, you must continue visiting the website,
Right.
unless there is something I'm unaware of. That is the protocol at this time.
It's the easiest way because we update it constantly. That is the most reliable source of information. As we begin to have more vaccines approved, then we'll be opening up, more slots as we begin to get more staffing and volunteers, and we'll be able to do that as well. And as more community partners start to assist us in providing vaccine, that will also open up more slots. So everything, the web is everything, and we try to keep it as comprehensive. I literally try to sit and think of questions that I would ask as a private citizen, and that's what goes on the web. So we try to be as forthcoming and transparent as possible. And, sure, there's things that need to be fixed in the system in terms of efficiency, but you will not find a more dedicated staff.
I agree, because I've had a front row seat. There is also a question here from an individual who literally says, I'm curious as to why individuals with severely compromised immune systems, individuals who have received solid organ transplant, chemotherapy, immunotherapy, have not been placed at the top of the vaccine list. Because I do appreciate, Dr. Griffith, you going through the current rollout is for 1A plus only individuals. And of course, that has now been open to include individuals that are on the front line, your police officers and various other service providers. But I do want to say, and again, correct me if I'm wrong, the directive for the rollout was derived on the federal level, and we are, to my knowledge, only implementing. So again, this goes to the conversations, and this is why it's important to vote and have your voice heard and be reasonable on the federal level with representation, because again, I share this particular concern because I have those who are very close to me that have suffered from various forms of cancers, who have extremely compromised immune systems. But at this point, it is not an option to move those individuals to the top of the list, as those decisions were made on the federal level. That said, we are 10 minutes out now, and I did want us to end promptly at 7:30. I do believe we've done a good job of answering the bulk, the lion's share of the questions that we've received. I know that this has not been an easy rollout. I see a question here related to asthma, and I'm asthmatic. So I share that concern, and that's why I'm very cautious with interacting with people, because I know that I struggle to breathe. And unless you're close to me or you are in a quiet room, you may never notice that. But many of us have serious concerns still. But hopefully this evening we have done our best, and you have found this conversation to be beneficial to you. I would ask each panel member at this time, if there are any remaining thoughts that you would like to share. I will urge those who are interested in taking the vaccine, who have not at this point, to continue visiting the DeKalb County Public Health website, so that when there is availability, you can register. Also, you can check with your local physician. Dr. Griffith here tonight has provided information on Kaiser Permanente, and I'm grateful for their commitment to assisting. because there was never the expectation on the federal level that the Department of Public Health would be the sole provider of the immunization. But again, there's a big difference between theory and practice. In theory, others would rush to be a part of the process. But in practice, that has not happened. And because of COVID, we are already working with a diminished medical staff. But if nothing else, I sincerely hope tonight that everyone understands the magnitude of what we're dealing with. The fact that we must continue to be socially distant. We must continue to wear our masks. We must continue to exercise the best possible health practices because we are far from in a safe zone. And at this time, I will allow you at random to respond, and not so much respond, but provide your closing statements at this time, not to sound like a lawyer.
From my perspective, thank you for an opportunity just to help the community understand what we are trying to do here. No one is intentionally withholding vaccine. Contrary to popular belief, I do not have a stash in my trunk. We are working with what we have, and I will continue to ask for the community's patience. And I will also continue to thank DeKalb County government for everything you all do to support me and my team. This has been such an amazing community effort in this county. The reason we are number 7 in districts is because we have a good team that works well here, and I really appreciate that.
Again,
and I will say that I am really appreciative of the opportunity to be here and hear the community's concerns. One of the things with vaccines is that people don't feel like they get their questions, at least have a voice, and we want to hear your voice. And so we're very, very appreciative of the people to hear your concerns, to read your concerns. And what we would recommend at CDC is that if you have questions, to see your medical provider, come to forums like this to get your questions answered so that you get reliable, factual information for you to make the best decisions for your families. These are safe vaccines that people do. If you have questions, get them answered.
And a sincere thanks again to Commissioner and her staff and panelists. And just to again emphasize to love your mother, love your neighbor, love your brother, wear your mask, wash your hands, socially distant, and get the vaccine as soon as you're able to.
Thank you so much. Thank you all for taking the time. I would also like to say that, being from Alabama, and this is something that we haven't discussed, but it is still very real. I think as it related to the vaccine, particularly in the Black and Brown community, there's always certain hesitancies because of the Tuskegee experiment and a variety of other factors. Because in Roll Tide, no, I'd say War Eagle, Miss Jones. I did attend Auburn, but I root for Alabama only if we're not playing at the same time or each other. But these are very real issues within our community, and there has always been a great fear in many instances of what the implications are that we may not be aware of. Myself personally, as it relates to COVID, after seeing and experiencing this pandemic, after watching the county invest well over, at this point, $30 million in food, housing, and rental assistance to help those who have been adversely affected by this pandemic. We have to set aside preconceived ideologies and work from a point of factual knowledge at this time. I think, Dr. Griffith, the analogy you gave of MMR was probably one of the best statements made this evening, because I know personally I had the measles, mumps, and rubella shot, just like everyone else, and you took it because it was in your best interest. It was absolutely required to walk into school when I grew up. But at this point, we are dealing with a global pandemic that has taken the lives of over 40 million people on a global level. So let's work from a standpoint of fact. If you're not receiving my newsletter, please register. I do consider it to be the most thorough in the county. And I said that and I stand by that. And I may be biased. However, I will continue to provide updates on vaccines as they're available, and any information as it relates to the latest updates on COVID will be on the DeKalb COVIDinfo.com website. So may God bless us all. May He continue to protect us. If there is anything we can do to assist you in District 7, we are here. We have gone mobile. We now have the COVID-19 van. So if you are in need of PPE equipment, you can reach out. We will have a hands-free delivery of masks, sanitizer, and PPE equipment to you, because I do not want anyone to go unprotected during this time. So thank you so much. And at this time, Allison, I guess we will bring down the Facebook Live, and everyone will go about their evenings or night at this point.
Will do.
Thank you.